Mr. President, with me today is one of my colleagues from my office, Mr. Nick Ayers, whose good judgment and counsel I depend on. Mr. President, I want to talk about the Medicaid portion of our reconciliation bill, which the President calls our one big, beautiful bill. And I want to talk about the rest of the story. Now, the Congressional Budget Office is a bipartisan entity, as you know, Mr. President, that advises us on fiscal and financial matters. And I appreciate their good work. A lot of smart people over there. The CBO, as we call it, has issued a report that says, as a result of our reconciliation bill, the so-called One Big Beautiful Bill, that 10.5 million Americans are going to be thrown off Medicaid. Let me say that again. CBO says that as a result of the One Big Beautiful Bill, 10.5 million Americans are going to be thrown off the Medicaid rolls as a result of our bill. And I don't want to be unfair to CBO, but sometimes CBO makes these statements and they don't give you the context in which they're making the statements. If you say we're going to throw 10.5 million people off of Medicaid and don't explain in detail why they come to that conclusion, that's not fair. You're not getting the full story. You're not getting reliable information. That would be like asking a nun for advice about sex. So let me tell you the other half of the story. I talked about this last week a little bit. Of the 10.5 million people that CBO says we're throwing off of Medicaid, they weren't eligible for Medicaid in the first place. I'm going to say that again. CBO says we're throwing 10.5 million people off of Medicaid. They weren't eligible for Medicaid in the first place. I talked about this a little bit last week. For example, the Centers for Medicaid and Medicare Services just came out a report with a report of those 10.5 million people that we're throwing off of Medicaid. 2.8 million of them are double dipping. They're double dipping. That's illegal. That's a violation of the rules. That means that a person is signed up. I'm from Louisiana. That means some people are signed up in both Louisiana and Mississippi, for example. You can't double dip. And the Centers for Medicare and Medicaid Services also found that of that 2.5 million people, 1.6 million of them are double dipping by joining Medicaid and Obamacare. So yeah, they're going to lose their Medicaid. They should. That double dipping costs us $14 billion a year, $140 billion over 10 years. We think in 10-year cycles. That's money that we could use to help people who really deserve Medicaid. So yeah, my friends at CBO, those people are going to lose their Medicaid. Did I mention that they weren't entitled to it in the first place? Now, point two, the reason that the main determinant for Medicaid is income. It's not the only one. The main determinant is income. States are not supposed to sign up people for Medicaid who make too much money. And I regret to say this. I don't know why, but it's human nature. Some people don't tell the truth. Under President Biden, he encouraged the states not to check income eligibility. Just take everybody's word for it. Well, you know, you've probably heard me say this before, but I trust people. But I also, when I play poker, I play with friends. They're good friends of mine, but I always cut the cards. I believe in the old adage, you know, trust in God, but tie up your camel anyway. If the president sends a message to the states, don't worry about checking if people are making too much money, guess what? Some people are going to cheat, and they do. I wish they didn't, but they do. Back in my state of Louisiana, our legislative auditor, Louisiana legislative auditor, which audits all the spending in the state, found that they did an exhaustive audit of our Medicaid program. They found back in 2019 that 1,600 people had been signed up for Medicaid, making over $100,000 a year. 1,600 people making over $100,000 a year. Yes, CBO, they're going to lose their Medicaid. They weren't entitled to it in the first place. The legislative auditor went on to point out that Louisiana paid $85.5 million in Medicaid payments for patients who weren't eligible for coverage because they made too much money. And my legislative auditor in Louisiana, we have a lot of people on Medicaid. He couldn't go through the numbers for each and every one of them, so he had to do a statistical sample. And he listed, I won't show you the list of all of them. You could stand on the thing and paint the ceiling. But he found, for example, on our Medicaid rolls in Louisiana, someone making $111,785. Here's another person on Medicaid making $126,284. Another making $104,921. Another making $114,797. This is Louisiana. Our median family income's only $56,000. These folks aren't qualified for Medicaid. They're taking money away from people who deserve it. So yes, CBO, who on this issue is giving us their advice, I'm going to say it again. It's like asking a nun about advice on sex. CBO's not telling us the full story. Yeah, they're going to lose their Medicaid. They're not qualified for Medicaid. They're cheating. Let me talk about a third way that CBO is misleading us. And I'm not saying CBO is doing it intentionally. Some may say otherwise, but I'm not saying that. I'm just saying they need to explain their answer. If you say we're throwing 10.5 million people off Medicaid, you know, you got to give us the rest of the story. It's not fair to just take that out of context. Technically, they may be right. But did I mention I can't remember if I mentioned this, these 10.5 million people weren't qualified to get Medicaid in the first place. Now, we also put in our reconciliation bill, as the President calls it, the big, beautiful bill, a work requirement. Sometimes, not always, but sometimes the best way to get back on your feet is to get off your ass. Now, the American people are the most generous people in the world. We spend trillions of dollars helping our neighbors. In our country, if you are hungry, we will feed you. If you're homeless, we will house you. If you're too poor to be sick, we will pay for your doctor. That's why we have Medicaid. That's why we have Medicare. But those who can work should work. Our social programs were not meant to be parking lots. They were meant to be bridges. Sometimes, it's not always. If you're disabled, you should be on Medicaid. If you're too poor, you should be on Medicaid. But we've got a lot of people on Medicaid, we're not sure exactly how many, who could work. They choose not to. So when we passed this bill, my Democratic friends opposed us every step of the way. But we passed, over their objections, a work requirement. Now, if you're on Medicaid, the expansion part of Medicaid, I don't want to digress here, but if you sign up on the expansion part of Medicaid, if you are 19 to 64 years old, if you're not disabled, so I'm not talking about a mother with a sick child in her arms. If you're 19 to 64, if you're not disabled, if you're healthy, and you don't have a child at home under 14, we're saying we'll give you Medicaid, but you've got to work. Not 40 hours a week, 80 hours a month. For 80 hours a month in return for the free medical care, you've got to go try to get a job. You can go to worker training or you can do community service. And hopefully, you'll become gainfully employed and you won't need Medicaid. Because a person without a job is not healthy, he's not happy, and he's not free. We don't know exactly how many people are on the Medicaid expansion who can work but aren't working. There have been some estimates. I've seen them all over the map. I was looking at one in The Economist recently. They estimate that 6% of the 71 million people on Medicaid are able-bodied and could work but choose not to. That's 6 million people. That's 6 million people. If the average amount spent per person on Medicaid is $9,000 a year. So if we could get all of those 6 million people to work, and we'll help them find a job, we'd save $54 billion a year. That's $500 billion a year over a 10-year period. So yes, CBO, it's true that if someone is covered by the work requirement and they say, I don't want to work, I choose not to work, then they're going to lose their Medicaid. And again, we're not talking about somebody disabled or somebody pregnant. We're not talking about a mother with 3 young children. We're talking about able-bodied adults, 19 to 64. They're healthy, and they don't have kids at home. All we're saying is, come join the American dream and get a job. So yes, CBO, they'll lose their Medicaid. They weren't eligible for it in the first place. So I just want to say to my friends at CBO, I don't mean any disrespect. I don't. They're really smart people. But when you're going to throw these numbers around, like 10.5 million people are going to be thrown off Medicaid, you ought to explain why. So the CBO report, as far as I'm concerned, is all salt and no tequila. They don't tell us why 10.5 million people are going to lose their Medicaid. And unless you have an opium habit, you'll see, if you drill down and understand and try to understand, that those 10.5 million people, God bless them, but they weren't eligible for Medicaid in the first place. And these reforms that we're making to Medicaid are going to be able to provide much more money for the disabled Americans, the truly impoverished Americans, the truly sick Americans, the children who are too poor to be sick in our country. We're going to take this money that we're saving and give them the quality health care they deserve. And even after all these reforms, guess what? Hope you're listening, CBO. We aren't cutting Medicaid. Even after all these reforms, Medicaid's going to go up 20% over the next 10 years. And that's the rest of the story, Mr. President. My work here is done. I yield the floor to my good friend, Harvard graduate. He went to Harvard. You know that, Mr. President? Smart as a whip. Mind like a steel trap, Senator Tom Cotton.